Hi, I'm Dr. Christopher Bunick, Associate Professor of Dermatology at the Yale School of Medicine. I'm here on JCAD TV to talk to you about rapid itch relief. This is a poster that I was lead author on at a recent meeting, and I want to share with you the results. Let's first break down what this poster covered. This poster covered rapid itch relief with upadacitinib compared to dupilumab in adults and adolescents with moderate to severe atopic dermatitis. This is from the head-to-head Level Up clinical trial. Now, how do we define rapid itch relief? Well, rapid in this particular analysis was less than 28 days. So the first 28 days of therapy. When we think about the Level Up clinical trial, there were two periods. This data comes from the first 28 days in period one of Level Up. What was period one? Period one was a head-to-head comparison of upadacitinib 15 milligrams with dupilumab per label, which is the 600 milligram loading dose followed by 300 milligrams every 2 weeks. So we are looking at an on-label comparison during the first 28 days of these two medications, upadacitinib 15 milligrams and dupilumab per label. There were two different ways that itch was measured over those first 28 days. There was clinically meaningful itch response, which is worst pruritus numerical rating scale of 4 points or more improvement for patients that started out with a score of 4 out of 10 or greater. There's also little to no itch, or the optimal treatment target of little to no itch, which is itch 0 or 1 on that numerical rating scale. If we start out by looking at clinically meaningful itch, what was observed was that on day 2, the first day after starting therapy, there was already a statistically significant separation between upadacitinib 15 milligrams and dupilumab. At day 28, approximately 51% of patients with upadacitinib 15 milligram treatment achieved a 4-point or more improvement, that clinically meaningful itch response. And this was compared to approximately 29% for dupilumab, almost a 20-point difference. If you look back at the data, 18 days earlier was where upadacitinib 15 milligrams hit that 29% response rate, showing the advantage of starting, in this case, upadacitinib for this group of atopic dermatitis patients led to 18 days more of clinically meaningful itch response. We've heard a lot about the AHEAD task force, the Aiming High in Eczema and Atopic Dermatitis task force, that has charged us as the clinicians with trying to achieve optimal treatment targets for skin clearance and itch relief in our patients within 3 to 6 months. When we look at that stringent optimal treatment target of little to no itch 0 or 1 on that 0 to 10 scale, in this particular trial, in the first 28 days of the period 1 of Level Up, what was observed was as early as day 4, 3 days after starting therapy, there was a statistically significant separation between upadacitinib 15 milligrams and dupilumab. If you go out to day 28, there was an approximately 19% of the upadacitinib treated patients were hitting this stringent target of itch 0 or 1 compared to only 6% of dupilumab. This is more than threefold difference. Three times more patients were hitting an optimal treatment target for itch of little to no itch. This is very meaningful. Why is it clinically meaningful? Because when we think about the most burdensome symptom in atopic dermatitis, patients often refer to itch as that most burdensome symptom that is causing the disruption of their life, whether it is work productivity, school productivity, sleep, or the ability to function in other ways. That overall quality of life is affected most deeply by itch. So rapid itch relief does matter. And in the case of achieving little to no itch, this was approximately 19 days more of little to no itch relief for patients with this atopic dermatitis on upadacitinib compared to dupilumab. 18 or 19 days, whichever way you cut the itch, whether it's the clinically meaningful or the optimal treatment target, 18 or 19 more days of itch relief is a substantial improvement for these patients. It's giving their life back early. And in other clinical trial data, or in other data looking at upadacitinib, the reality is that this itch relief is durable. It's not just in the first 28 days. There's data showing it is maintained over time, even out to 4 years is where some of the data now lies. A couple key points about this data. It was um, it was non-responder imputation data, so very rigorous analysis, not as observed. And second, the assessors for these measurements were blinded to the therapy. So that it was efficacy assessor blinded. That was one of the strengths of the Level Up trial. Those doing the assessments did not know which therapy the patients were on, and that helps reduce the bias. Lastly, I'll point out that this data was adjusted for age and baseline IgA, bringing some statistical rigor to this understanding. Now, why is it that this result occurs? Let's remember the mechanism of action of JAK inhibitors. Upadacitinib is a JAK1 selective JAK inhibitor. It works inside the cell very rapidly to shut down signaling from multiple itch-related cytokines. This can be from inflammatory or neuroimmune pathways, whether it's IL-31, IL-4, IL-13, or TSLP. This is why inhibition with JAK inhibitors like upadacitinib can make a significant and early and rapid itch difference in atopic dermatitis patients.